So far, I have performed Mcmurray's test several times, and every time I have performed that test, I have learned something new. Not only about Mcmurray's test, but in general about special tests. This video is not just about learning from Mcmurray's test, but learning all about special tests so far in my journey. From knowing nothing to now understanding the fundamentals, I will be sharing with you all how I have learned different things about special tests at every phase. So let's start. In the beginning, when I first learned about special tests, I was only focused on the right technique. The only focus was on how to perform the technique correctly. How should be the patient position? How should be the therapist position? What should be my hand placement? What is the movement that I need to perform? Even that was a big task at that time. So, in the beginning, all that I was worried about was knowing how to perform the technique correctly. What should be the sequence of the steps? That is how you start. Every special test has a sequence of steps, it has a correct technique in which it needs to be performed. And the first target, the first goal is to learn the technique. Next goal was to understand when is the result positive. If I'm performing a special test, how do I understand if the test is positive or negative? For that, I need to know the normal response. I need to know what is the result of this test in a normal individual. So if I'm performing Mcmurray's test, I need to know the response in a normal individual, and only then I will be able to understand when I see a patient with a meniscal injury. So it is important that you practice the special tests first on normal individuals and then on patients. Only when you know the normal response, you will be able to understand the altered response. So the next target was performing the test several times on normal individuals. And then I started performing it on patients. And that is when I started understanding that, okay, now the test is positive. This is how the positive result looks like. Now, so far, I had understood how to perform the test correctly. I knew the technique and I knew the correct interpretation. I knew what is the response of the test when it is positive. The next important thing to learn was when to perform the technique. The timing of the test is extremely important because not every positive result is a positive test. If a patient has a history of an acute injury, every test you perform is going to give you a positive result. So it is important to understand, to differentiate if the test is really positive or if it is a false positive result. If the patient's symptoms are being reproduced because of the structure that you are testing, or it is because of overall irritability of the joint, that is an important question. So you need to understand if the condition is acute, when there is muscle spasm, swelling. If you perform the test, it is going to elicit the patient's symptoms and the test is going to be positive. That does not mean the test is really positive. So you need to understand when to perform the technique, when to perform the test. If I have to perform Lashman's test in an acute ACL injury, if I perform the test, I will not get the correct result because the muscle spasm will mask the result of the test. Now I knew the basics correctly. I knew the technique, how to interpret the result, and when to perform the test. This is when I started understanding the clinical value of a test. Does a special test confirm a diagnosis? Not really. It just adds or decreases the probability of that particular diagnosis. And that is where two terms, that is sensitivity and specificity, come in. You will be asked whenever you are performing a special test, what is the sensitivity of this test, or what is the specificity of the test that you are performing. Why is it important to know that? Sensitivity and specificity are two terms which help in understanding the clinical value of a test. If a special test is sensitive, it helps in ruling out the condition. And if a special test is specific, it helps in ruling in that diagnosis. And it is important to know that, because now you are because now the focus is not just only about performing the technique correctly, but also deriving meaning from the test that you are performing. What is your understanding after you have done few special tests on that particular patient? What is your conclusion? What do you understand?